Thank you very much for coming out on a cold day. So the purpose of today's news conference is really to discuss influenza. I know we've talked a lot about respiratory viruses over the preceding months, but what we really want to focus today on is influenza. So this flu season has had a significant impact on children, and we expect every year to see influenza impact on our 6 months to 5-year-olds. But what we're actually seeing this year is a significant impact on our 5 to 16-year-olds or our school-aged children. This is in part related to the type of influenza that's circulating, influenza B, and that type tends to be associated with a greater impact on school-aged children. So what we're actually seeing is that children under 16 years of age represented about half of all ED presentations for influenza-like illness, and over a third of all influenza-like illness hospital admissions in the past week. So you can see that significant impact on that age group under 16. So my key message to you today is please get your children vaccinated ahead of the return to school. We generally see infectious disease settle down over school holiday periods, but we often see an uptick once school resumes. So please get your children vaccinated during these school holidays. The vaccine is their best protection. So children 6 months to 5-year-old, up to 5-year-old age group are eligible to have free vaccine at their general practitioner. Pharmacists and GPs can provide the vaccine for those over 5 years. It is not free unless you have underlying medical conditions. I'm here today with two of my colleagues, Professor Christine McCartney from the National Centre for Immunisation Research. So she's going to answer some questions around the vaccine. And also I'm here by Dr. Matthew O'Meara, the Chief Paediatrician. I think to give you a sense of the impact that this is having on children, and also to convey to parents some key messages about watching out for children that might be deteriorating. Children that might have something that triggers the need for them to have more acute level care, and early intervention is critical. So I'll hand over to Christine McCartney to just give us a bit of an update.
Thanks very much, Kerry. And just to give you a flavour of what we're seeing at the moment, we are seeing a real uptick in the number of flu cases. This year's flu season is looking to be much longer than previous years, and as Dr. Chant said, it is characterised by influenza B. So sometimes the flu can be mild, but in some children it can lead to very serious complications. This includes in previously healthy children, who represent the minority of the children hospitalised with us. Most are previously healthy. We're seeing complications that involve the lungs with pneumonia, the heart, the muscles, brain and kidneys. Some of these complications lead to children being in ICU, and in the recent weeks we've seen an increase in the number of children in intensive care. Children can become sick from the virus itself, but it also can cause secondary bacterial infection and rapid deterioration. What is concerning us at the moment is that children are needing very high levels of care, some even life-saving treatment with heart-lung bypass machines at this time. So we are seeing mostly flu B, which Kerry mentioned. It's important to remember that the vaccine prevents both influenza A and influenza B. It contains 2 strains of influenza A and 2 strains of influenza B. And we think it's a good match this year that is giving good protection against severe disease. We recommend flu vaccine for everyone to protect against the flu. So really encouraging the whole family to be vaccinated at this time when the flu season is looking severe. For children in particular, it's very safe, really no safety issues at all, and it's so easy to have and so protective. So very much encourage children of any age to be vaccinated against the flu, and it's free for those under 5. For youngest babies, we get protection through vaccinating in pregnancy. So our other key message is if you're a pregnant person and you haven't been vaccinated against influenza yet, it will protect your baby when they're born against influenza. That's all from me, and I'll hand over to Dr. O'Meara. Thanks.
Thanks, Christine. So I want to describe what happens when a child gets flu. Sometimes it can be a mild illness, just a bit of a runny nose, a cough, a bit of a fever. The typical illness we see in kids coming to emergency departments and general practices is that these kids are unwell. They've got a fever that can last a week, a runny nose, a cough, feeling listless, lethargic, not eating much, not drinking much, often feeling unwell, sometimes nausea, vomiting and diarrhoea. And that illness lasts about a week and it goes away. And as Christine was describing, you can prevent this with a simple vaccine. What we know is that about 3 out of every 4 kids under 5 years of age are not vaccinated this year against the flu. And 7 out of 8 school-age kids this year are not vaccinated against the flu. It's a simple, easy vaccine. Not only does flu knock you out for a week or so, there are sometimes some really severe complications that can happen after influenza. It can cause inflammation of the brain, inflammation of the heart, infections in the lungs, either by the virus or by another bacteria on top of that, affecting the kidneys, or severe inflammation of the muscles so they break down. And we are seeing children in our intensive care units who need the highest level of care possible with all those complications. We've been seeing it for the last 2 months and cases are rising. While you can prevent it, there's some important messages for families about what you can do to recognise if your child's becoming more unwell. So if the child has had a bit of a fever, a cough, a runny nose, and then the pattern of the illness changes, if you think they're getting worse, you're absolutely right. Go and get help. If you notice they're more listless, more lethargic, more drowsy, more irritable, if they're having problems breathing, if their colour looks bad, if they're pale or mottled, if their fluid intake is really poor, or if they're complaining of severe pain that they haven't had before, they need looking at. Places where you go to, your GP should be the first port of call. There's also healthdirect, a national telephone service, 1800 022 222, where a nurse will help you manage the severity of the problem and advise you where to go for help. They can also connect you with paediatric experts on the phone to provide more detailed advice. If you're concerned that your child has an urgent problem and needs to be seen soon, your local emergency department is the right place to go. And if you're concerned they're critically unwell, call 000 for an ambulance. We're keen to prevent influenza as much as possible, but it's also important that we recognise complications of influenza so that we can treat it as soon as possible and prevent fewer kids ending up in intensive care on the highest level of support. We've been fortunate this year that there have been no deaths so far in New South Wales from influenza, but the season is not over. We are seeing cases rise. We expect there to be more children with influenza and more children with complications of influenza. So now's the time to do something about it, especially during the holidays. Get your kids vaccinated. Thank you.
Happy to take questions.
I'm not sure who this question should go to.
That's all right.
Is there any particular reason why this year it's been so effective? Is it a different strain?
So I think in part, and I think these questions are always hard to answer emphatically, but what we're seeing is more flu B this year, and flu B has tended to affect older age group children. So that's part of the explanation. But obviously we also want vaccination coverage to be high, and also those protective behaviours. So when school goes back, please, if your child has got influenza symptoms or cough and cold symptoms, please keep them home. We really want to prevent the spread, particularly in those congregate settings.
Why are vaccination rates so low?
Vaccination, we probably have identified that we need to do more to normalise flu vaccination for parents. We actually achieve very high rates of immunisation coverage for other routine vaccines, and we've actually had a concerted effort this year to try and support parents to understand the benefits of vaccination for 6 months to 5-year-olds where the vaccine is free. Traditionally, we only get around 30 to 40%, even in our highest level around 40%. We are hoping to push that up, But I think it is about us working with the community, I suppose, to break that misconception that influenza is a mild, it's just a bit of a runny nose. And I think that's probably more work on our part to do to keep the community informed. I think you'll be able to find a tape of Dr. Amira and I probably a couple of years ago. I think we were really aiming for well over 60%. But look, I will just want to see, we want to see year on year improvement, and it's our responsibility to support parents better understand the importance of vaccination, the fact that it's a safe vaccine and that influenza is a serious condition for some, and it's worthwhile getting vaccinated. One of the things that we've noticed is the flu season can start and end at various times. It can have double spikes. So there's a lot of uncertainty around how the flu season will play out. So one of our challenges is to say we don't know when the flu season will settle down. It's not too late. I think you've heard from Christine and Matt that we are seeing an increase in presentations to hospital. It really is palpable, the concern the clinicians have had. That's what really motivated us to come out today, is the fact that the clinicians have really seen this rise in cases. They've been distressed by the fact that they're particularly distressed because they've been previously healthy children, and we really need to work together to get those messages out. I might get Christine to talk about this.
It's not that it's necessarily worse, influenza B, as compared with influenza A. It just causes a slightly different pattern of illness when we look across the population. So it tends to cause more of the severe muscle pain. It tends to more affect school-aged children than the under fives. We're seeing a little over half of the cases in this hospital with influenza B. Some of the cases, though, in intensive care will have influenza A as well as influenza B. I think the patterns are not always easy to understand entirely every year, but both viruses, types of that virus can be severe. And that's really the key message today, I think. While influenza can be mild in many cases, and all your symptoms might be from another virus that is circulating that we won't protect against with the vaccine. But right now, the fact that we're seeing rising cases of influenza really just drives us to give that message that it's important to vaccinate in the holidays. It takes about 1 to 2 weeks to get protection from the vaccine, and kids will be going back to school again soon, having mixed in different parts of the world during the holidays, different parts of the country, and it's really important at this stage to get that protection on board for the coming weeks and months, and we hope, of course, that the season will start to resolve, but we can't say when. Yeah, so we see the best protection from the vaccine in the first 3 to 4 months, and there can start to be some waning of protection, out past 6 to 12 months. So we do recommend vaccination every year. If you were vaccinated last year, you should still be vaccinated this year, and we actually recommend annual influenza vaccination. The other reason that we recommend annual vaccination is we tailor the vaccine each year with the type of strain included. We predict what the vaccine will be needing to have to match the strains that we think will circulate. And as I mentioned earlier, all indications this year are that the protection we're getting from the vaccine is well matched against the type of viruses circulating. So again, another good reason to be vaccinated as soon as you can. So Kerry might want to add that we are seeing our vaccination rates looking similar in older Australians, but I think we can do a lot better. So Kerry, do you want to add on that?
Separately to this, we have been really pushing the messages around our over 65. We generally do well with our over 65s, and I want to just applaud them in general, but we are seeing a drop-off this year. We are working with our colleagues in general practice and pharmacy sector to understand those barriers, but again, I would be liking to see that over 65 medically at risk vaccination to also lift, and also we're working strongly with our Aboriginal partners in Aboriginal medical services, and a big call out to all the hard work they're doing. Their vaccine coverage for their over 65s is greater than non-Aboriginal, so that's a really good call out to all the hard work.
For mum and dad as well, I mean, a lot of us can, you kind of go to work and they the vaccine work, but should mum and dad get the vaccine when they take mum get it as well, because they can go to school?
We would actually like it to be a family endeavour, and I think that models really good behaviour. So we do recommend flu vaccine for everyone over 6 months of age, and as Christine said, vaccination in pregnancy is the way that we protect our newborn babies because they're too young to be vaccinated.
Can I ask, what about the number of how are the statistics at the moment? What is the
Well, clearly our emergency departments are very busy, and that's why we also have services that Matt talked about in terms of healthdirect if people are uncertain. GP is the first point of call, but we do have those services that can provide some support. If you're uncertain, please ring healthdirect. Obviously, we don't want anyone to delay accessing emergency care or ringing 000 if that situation is necessary. Clearly, this is a busy time in winter, and so therefore we do ask that people consider those other options if it's appropriate.
We've got a few children currently on heart-lung bypass for a range of different problems. Sometimes a heart problem, sometimes a brain problem associated with. That's really unusual.
So,
Is it all sort of...
our weekly respiratory report is also released today, and COVID has settled. We are seeing a decline in the circulation, but it doesn't mean that it's not about. Again, please continue to take those COVID-safe practices, get vaccinated for COVID. We are also seeing RSV about, so we're sort of saying that COVID's dropped down to sort of low to moderate levels of transmission or activity in the community. RSV's moderate levels, which is another virus that can cause particularly the young ones and the elderly to be unwell, but there's currently no vaccine for that, and influenza is on the rise.
So just in terms of vaccinations, I know you have local ones, but kids aren't getting boosted for COVID, are they?
Yeah, so generally the impact of COVID on children has not been as severe, and we've actually really just trying to emphasise that influenza is much more serious condition for young ones. There are certain groups that are recommended for boosters. I don't know, Christine, do you want to talk about?
Yeah, I think the COVID vaccination recommendations in children now for the booster only focus on children with substantial underlying medical conditions. And, that's certainly an option for children. But for COVID, we're really emphasising having the 2023 booster in people over 65. If they haven't had it yet, we can still do more with our vaccination rates there. And similarly, it's a very, safe and beneficial option for any adult to have a booster in 2023 if they haven't had one. Just if I could mention on the influenza vaccination rates, they are available and updated every single week on the National Centre for Immunisation Surveillance website. If you just ncis.org, and you'll see some nice graphics of where our influenza rates are tracking. And we definitely, have done better in past years. So as Kerry said, I think one of the key take-home messages is to recognise that influenza can be severe. And we, from doing research, interviewing parents, families, they often say, I just never realised the flu could be so bad. I wish that I'd known. And we hope that that message can be heard today as well. Thanks.
parents and the general public, including
I think, like all things, there's many factors that play into vaccine coverage. What's pleasing, though, is our childhood vaccination rates have actually held up pretty well. There's clearly been a focus on catching up, particularly in our school-based program. I am very concerned with our lower influenza rates in our over 65s. I think we do need to work with the community to understand the barriers to vaccination, and vaccination is such an important thing, so we do need to make it easy, accessible, and support the community with the information they need to make those decisions about vaccination for them.
So when you take kids to get their flu vaccine, make sure you take their grandparents.
Take everyone that you can to get vaccinated. But look, it is really important that we do focus on the prevention aspects, and also a visit to get your flu vaccine can also talk about your other health issues. It's a good opportunity to get those broader health checks. Often GPs use the opportunity to vaccinate over 65s to talk about their other chronic diseases, give them a plan for winter about what antivirals they might need to do, what their tests they might need to do. So just use the opportunity to get the vaccine as a more holistic health check. Thank you very much, and thanks for coming out.